Mhm. Good morning, everyone. Um, just like Zita just mentioned, uh, I am from the Center for African Studies, and I did want to tell you about an opportunity just before I introduced Dr. Fapohunda. This summer, we will be taking teachers to Uganda and Kenya to develop lesson plans there. So if you are interested, please stay tuned. I'm sure you guys are all on our mailing list, so you'll be getting our mailings from the University Center for International Studies. But you can also reach out to me at our center if you have questions about that. We would love to take you with us. So it's an amazing opportunity. It's a Fulbright Hays project in Kenya and Uganda for educators like yourself. So stay tuned for that. Anyway, I have the wonderful pleasure of introducing our speaker this morning, Dr. Abi Fapohunda. Um, she is a trained epidemiologist and health educator with over 20 years of experience of running her consulting company and being in public health. She's an instructor in the Department of Africana Studies and the School of Public Health at the University of Pittsburgh. Some of her coursework, talking with her yesterday, I know a little bit about what she teaches, but she teaches health equity and detriments of health, African American health issues, intro to global health, and health in the African diaspora, and essentials of health equity. So today, I know she is excited to share with you a little bit from her course, Health in the African Diaspora, and I think hopefully you guys will get a lot out of it because I've seen her PowerPoint slides and it's exciting. I definitely had some epiphany moments. So, and should I mention also that she's a grandmother who she also takes great pride in those grandchildren. So, anyway, take it away, Dr. Fapohunda.
Thank you, Anna Marie. Can you hear me? Okay, thank you.
Yes.
Yes, I'm going to share my slides now. Can you guys see that? Okay, thank you. Hello, everyone. I'm excited to be here. When I heard about, what this conference is about, I'm just so excited, especially being with, teachers and educators. And I know how important you guys are in the lives of every one of us, starting from a very young age. So I really appreciate the kind of work you do. And I'm so happy to join you guys to share just some of the classes subjects I teach, and in a very, summarized form, and then to be able to see the kind of projects my students do, and then to see if that will, if that could really trigger some ideas in the kind of courses you teach and classes you teach, and bring out some really good projects. So let me start by saying with the overview. I'll just give you a quick introduction. These are just like really quick overview of things. I may not be able to get too much in depth because there might be questions, but just to give you a quick overview of what Africa diaspora means. And then I'll talk briefly about the trans-Atlantic slave trade, and then really bring that into the present age, to the current situation, talking about social determinants of health. And these are the social and economic factors that really affect people's health, and which will determine if you're going to be, you're sick, or you're going to be well, or you're going to live long. And then I'll briefly give you examples of some global health disparities, because I have particular countries that I'm focusing on, and then give you examples of projects for my students. And then finally, we wrap it up by, how do we engage students with something similar to what I've just presented. So my first question, which I'm going to answer, is what is diaspora? When we're talking about diaspora, it's the movement of the population from its original home. And on the, having a mass movement from one place to the other, and it could be through, it could be voluntary, it could be involuntary. It's just this mass dispersion. And the involuntary ones could be maybe there's a famine, there's people really don't have the intention of moving out of their space, but due to circumstances, they're now in a position that they have to move, either because their lives are threatening, or it's just not a conducive place for them to live anymore. But in the past centuries, there was mass dispersion or mass migration of mass movement of Africans from the continent in the 16th century, and this was involuntary. This was when people were kidnapped and enslaved and brought into the Americas and the European countries. So that's what diaspora. So when we talk of the African diaspora, is the movement of Africans. As late as over 400 years ago, the movement of Africans into other parts of the world, the Americans and Europe. And then when now we're talking of the voluntary dispersion of people, now people voluntarily want to come to the United States, want to come to Europe, either to be educated or, to come for schooling or to join their partners or things like that. So that's the voluntary one. So both of this movement could be voluntary or involuntary. This is a map I would like to share with you. It's a map from 1650 to 1840, 1860, during the time when the enslaved people were moved from the coastal part, western part of Africa. And then because some of the countries you barely see at this time, because some of those countries were not even formed. They were not, they don't even exist at this time. So, but this is where you will see most of that movement, this coastal part of Africa. And you'll see Nigeria. Nigeria is somewhere here because I'm going to be talking about Nigeria. It's not on this map because Nigeria doesn't exist at that time. So you see all that movement. So the movement you can see all through the Americas, South America, Central America, the West Indies, and Northern America. And it gives you a good idea of even the numbers of people, of enslaved people that were moved. Most of the enslaved people were moved into the West Indies, 4.5, because most of the slave masters were Europeans. They were, from Britain and all of that part. So most of them, they did not move a lot of enslaved people to Europe. But you can see they have all their, plantation in the West Indies, and just half of a million of them came to North America, and you see a significant number of them were in places like Brazil and Cuba and all of those places. And then you can see that these are all the kinds of products that were produced, very, very important. And at that time, this is what was running the economy of Europe and the US as well. And people, they grow cotton and coffee and cotton, and most of these things were not even used in the Americas. They were sent back to Europe. So the next, let me see. Yeah. So this is another map that really explains the trans-Atlantic slave trade. You will see that people were moved, enslaved people were moved into the Americas. And then what they did was produce all those things, and then they move all those things back to Europe. And then from Europe, what they bring from Europe are things like weapon and fabric and alcohol, which is like, these are things that are usually dangerous that people use against each other, where they're presented to to people, the connections they have to be able to enslave people. So they give the people who are in charge to release those enslaved people, they give them weapons, they give them alcohol. And you can see the danger in that and how they use that against their own people to be able to release them to the Europeans. Now, just want to give you an idea the amount of work and how diverse the skills of the enslaved Africans were, and how the economy was really run by these enslaved people. they did a lot of agricultural production, because where they come from, they were very good at farming, because that's their livelihood, farming and fishing. They were very, very good with crafts and things like that. They did a lot of metal work. They did a lot of lumbering. They worked in textiles and dyeing, and they worked in tobacco and plantation and rice estates. And they did a lot of fishing and cattle pastures. You can see how diverse they are in the kind of work they did at that time. But the impact of all of this work that they did, majority of the enslaved people spent most of their waking hours exposed to the force of nature. Some of them were up to 12 hours a day in heat, in really high heat, in really cold temperature throughout, and never had a break. And that took a toll on their body, and that took a toll on their health. And even when they have to rebel, sometimes that the body is tired, they can't go on, they can't keep on going on. With history, we learned that they were flogged, they were whipped, they were beaten, some of them beaten to death sometimes, if they really were not really doing what they need to do. So because of this the kind of work they do and the kind of exposure they had at that time, they had a lot of issues with their health. For example, they had a lot of coughing and diarrhea and dysentery and pneumonia because of the cold weather. They're not used to the cold weather. They came from a very, very, hot climate, and suddenly they're now put in a very cold climate. It doesn't go well with their body. A lot of them died of pneumonia. And infant mortality seems to be very, very high at that time, because there's a lot of suffocation, a lot of smothering babies, and sleeping over babies, and lots of sudden infant death syndrome. And the reason is that when you live in when you day in, day out, you live in a very, very confined space. A lot of them, maybe about 50 enslaved people in a space that today maybe is just one person's room, just a room for a person. About 50 people just lay on top of each other there. And so when you have a newborn baby, it's easy to sleep over the baby and smooth the baby. So in fact, the infant mortality rate was so high at that time. And the sad thing about this situation is even today as we speak, infant mortality rate is still very, very high among Blacks all over the world, even here in the United States. And there's a lot of transmission diseases that they can get that are very contagious, that people are very infectious, and things like yellow fever and smallpox. It all is because of that kind of environment. So you can see that it's a group of people that have a lot of health issues at that time. And the reason is, as we said, the exposure to cold weather takes a toll on their body. They worked outdoor all season throughout the year. It's often where they live is often very cold. They sleep on the floor, on the wet floor, nothing on the floor there. And their diet was very poor. The basic diet for enslaved people at that time, like oatmeal and cornbread, very basic. No other things that we provide, other vitamins that we take for granted now. And because of that, they have a lot of vitamin deficiency, which makes them very sick. And they overcrowding and unsanitary living condition. And a lot of them had frostbites because of the weather. And the issue of frostbite, sometimes some of them will even lose their toes or their leg and so. So to just give you an idea of the kind of environment most of these enslaved people lived at that time. So now let's talk about the transatlantic slave trade, taking you to that journey through where, the unique health challenges that Africans in the diaspora, faced at that time and even till today. There's something called the slave health subsystem in the early century. And what this means is when we're talking about health disparity, health disparity is not, for some people, maybe they just heard about health disparity in the last 10 years, in the last maybe 5 years, or even during COVID, because during COVID, we begin to realize, oh my God, there's something called health disparity, and, Blacks are, they have less access to this, and they die more of all that. Health disparity is something that started 400 years ago, over 400 years ago. And at that time, because it's natural that you live and you get sick and you get treated and you're fine and you move on. But for people, enslaved people, what they got at that time is a kind of system called slave health system. And what this means is there was a slave health deficit. And the reason for that is legally, it's like it was legally sanctioned, and for medical and environment neglect. They were totally neglected. Enslaved people were neglected regarding their health. So they don't eat good food. They don't, because that's out of their control. When they're sick, they really don't take care of some of the illnesses, or except the except if the slave master sees, oh, I do not want this enslaved person to die because this is money to me. And then maybe they may even consider to take care of the medical situation. So for example, this system is is made up of enslaved healers, because these people came from an environment that they usually have their own healers. They have their own people. They gave birth to their own babies. There was no hospital or anything like that. So they know how to heal their own illnesses if they have all the natural things. So this system is made up of the healers, the enslaved midwives, the overseers that take care, take care of the enslaved people, and sometimes the wives of the slave masters. So this is the norm. This is the kind of care, and this is what is available to enslaved people at that time. And this was like a really inferior kind of health care. And that's where you see the disparity, the health disparity that we see today. That's when it began. Enslaved Africans received medical care only when it's clearly going to be profitable. If it's not profitable, they can just even let you to die, because they can replace you at any time. And this, what we see, as I said, has led to what some of the things we see today. Even though people are not enslaved today, but the kind of access to care and kind of things that the lack of access to so many things today results in the health disparity we see. So I have a question. The question is, when we're talking about people's health and how do you get sick? How do you get well? How do you live long? The question is, tell me, put it in chat. Tell me one factor that you think determines one's health. Just anything you can think of that really may influence your health. Let's see, chat. Yes, I see socioeconomic status and income. That's correct. Yes, family history. Thank you. Living condition. Oh, that's really, yeah. Oh, yeah. You guys are really good in, you really know a lot of social determinants of health. Wow, you're really covering everything. Food, geographical environment, yes. Work, yes. Pollution. This is good. I'm glad that you guys are educators anyway. You are knowledgeable of all this basic stuff. Yeah. Birthing condition. Yeah, all of these are quite right. You guys are really covering what we call the social determinants of health. Yes. I'm seeing some more still coming. Let me go to what I really want you to cover. Yeah, this is a nice table that covers what we call the social determinants of health. And social determinants of health means, social and economic factors that will influence your health, and that will either create the difference in health from one person to the other, or from one group to the other. It will determine the mortality rate, how many people will die. It will We determine the morbidity rate, how many people that are going to be sick. We determine the life expectancy, how long you're going to live, how much will you have access to healthcare, and even how long you're going to live, and what's the quality of life of living. Because it's one thing to live long, it's another thing to have a good quality of life, because you don't want to be in your 40s and have a complication of diabetes and already being on the wheelchair. That's a very difficult way to live for the next 20 years. So now let me go through each of these. When you're talking about economic stability, it does have a major impact on one's health, because the kind of job you get, the kind of education you are before you get a job. Because if you only have a high school diploma, the kinds of job you're going to get and your earning power is going to be quite limited compared to someone who has a degree, a diploma, or whatever, because the amount they're going to pay you. And it will now determine on how you get to be having access to so many things, to food, to good housing, to good healthcare, because some jobs don't even give healthcare. Because if you're in that lower income range, you do not have healthcare. And then you talk about, access to how much money you earn, the amount of debt you have, how much of your expenses, and all of that has a major impact, because at the end of the day, are you able to take care of your bills? Are you able to pay for good, healthy food? Are you able to pay a rent in an environment where it's safe and conducive for your family? Now let's go into neighbors and physical environment. The kinds of housing environment is very important. Some housing situation is just not conducive for good health. Some houses are full of mold because they are old. Some houses has lead poisoning, lead, which would create lead poisoning for your child. Some neighbors may not even be safe enough for you and your children to go for a walk. Do you have parks in your environment that you'll be able to have a nice evening walk, to be able to bring you down, to reduce your stress and just make you feel better? Playgrounds, and is it a walkable environment? And the zip code is very important. Some zip code in the United States, they say, tell me your zip code, I'll tell you how long you're going to live. Some zip codes, you can have an idea life expectancy in this zip code. And sometimes the difference between one zip code to the other within the same city may be up to 10 years of life expectancy. Someone in a zip code that is not very conducive may just averagely die at live till 65, whereas in the other zip code may be 85. So that's important. Education is another thing. What sort of education do you have? Are you even aware about your health education? What sort of education is available for your child? An early education for them to start learning and start, getting ready for school. And what sort of education do you have? Because that ties to your job. And then hunger and food is another thing, very, very important. So many people of color live in food desert. They don't have grocery stores in those places, and the kind of side stores they have are very, very, they're not healthy. And then we go into the social context and the community. Are you well integrated in your community? Do you have a sense of discrimination? Is it an environment that is really, really stressful? All of these factors we've talked about really has a major, major impact on our health. And we decide if you're going to live long or not. So you can see each of these factors I've just presented, in a really fast and quick way. Sorry for me going so fast, but I just want to make sure that I'm able to cover everything. My question is, which of these conditions contributes mostly to determinants of health? That's another question I would like to ask you. Economic stability, neighborhood, education, food, community, and social context, and healthcare system. Which one do you think contribute the most to determine your health? You can put that on chat as well quickly as I go. Yeah. Let me see, do we have anybody? Yes, yeah. 1 and 2, food, yes. Education, since, yeah. I see, you guys are, right. Yeah, good. It seems as if we're on the same page. This is good. Yeah, I want my grandbaby to be in all of your classes because you're really aware of what's going on. Okay, now let's this is the answer. What contributes the most of all of those factors, economic and social factor, are the everything. Only 20% of what we determine if we're sick or not sick is healthcare system. Some people may think, it seems as if most of you didn't even, nobody even mentioned healthcare system, which is good, which shows that you guys are really thinking about the other factors, because it's the other factors. You may have the best healthcare system, but it doesn't mean that the people are healthy, because at the end of the day, you get out of the health system and you have to still go back to your neighborhoods. And in those neighborhoods, these are all the issues that you have to deal with. You know, the bad housing, the neighborhood that is not safe, the job that is not well paid. And at the end of the day, even that by itself will make you a sick person, no matter, you know, the kind of health system you have in your environment. For example, in Pittsburgh, we have one of the best health system, but guess what? The Blacks in Pittsburgh, their health status is one of the worst. The moment you walk out of that environment of where the hospitals are, people are dealing with a lot of issues. Now I would like to now talk about Africans in the diaspora, and I'm going to be focusing on these countries, because these are the countries that I work with in my class. I'll be talking about Haiti, because you know Haiti is predominantly Blacks, and they are, you know, descendants of enslaved people. There's half of Brazil, more than half of people in Brazil are people of color. In Cuba, we have a very high percentage of Blacks as well, and we do have Blacks that people that moved into Canada during slavery, that, you know, it became their home. And then you have the native Canadians as well. And then we have the United Kingdom, and then the United States. And I'm going to add one more, a sub-Sahara country, Nigeria. The reason why I added this, because it's not part of the African diaspora, is because as you see that a significant number of enslaved people moved from that part of Nigeria into the Americas. And then you see that even till today, when we're talking about global health disparity, that disparity still exists. And when we're talking about global health disparity, you will see that there's the disparity amongst countries, like between Haiti and Brazil, or Cuba or Canada. At the same time, there's a disparity within a country. When you start looking at the different socioeconomic status, you see there's a difference. Let's talk about Haiti first, talking about global health disparity. Haiti is the world's first Black-led republic, but Haiti still remains the poorest, one of the poorest countries in the world. And this is due to so many factors. You know, foreign intrusion, you know, during time of enslavement, the Spanish, and then America, and all of those. If you look at the history of Haiti, a lot of foreign intrusion has created a lot of problems from centuries back for Haiti. And they had a lot of disasters as well, natural disasters, and poverty, and racial discord, and political instability, all of this. And when you look at in the last 26 years, they've had 3 major earthquakes, and all of these factors have really created a really poor health outcome for Haiti, even till today. The next country is to look at disparity. Large health disparity exists between white and Black in infants in Brazil. When you look at you know, the statistics, you will see that there's a major difference in infant you know, mortality. There are more Black babies that still die in Brazil, and you can see the ratio. It's more than like 30 13.4 compared to 13.9. That's really significant. More than half of black babies die in Brazil. Now let's go to Cuba. Cuba is unique. Cuba has has a very, very good health system. There are very few racial health disparity in Cuba. And even when you compare the health system in Cuba with the little resources they've had in decades, they are really coming behind the United States, which is like really surprising. But at the same time, it's not, because they are able to really focus on universal health care in Cuba and preventive care. But one thing about Cuba that really makes that disparity in socioeconomic status is the dual currency. They have a dual currency system, which is so sad, because what happens is people who are low income are paid in a certain way, and people who are in the high income are paid in a certain way. And the value of currency for the low income maybe 60 cents to $1. So when you are in that low income space, no matter even if you work 40 hours, the amount you'll be bringing home is half of what people in the higher tier income is. And that's created like a two-tier system in Cuba, that you have that the people of color, the Black Cubans, they call themselves all Cubans, and they say, oh, we don't have discrimination here and all that. But when you look deeply into most of these countries, you will see that there's a lot of disparities going on. And this in Cuba, even though they have a very good health system, the health of a lot of people, but that issue of socioeconomic status not having enough to use to pay, how to engage students. This is where this may be interesting to you, I'm not sure, but I want to share with you some of the things I've done with my students. What I've done is, after going through the whole, 12 weeks, because it's about 15 weeks for a semester, 12 weeks of, going through all of this, the root cause of health disparity, then I give them a project. I tell them that I need them to focus on this list: education, housing, the work system, community engagement, cultural competency, food security. I tell them that they can pick any of these topics. And what I do is I put them in a group of 3 to 4, and I assign a country to them. And that would be one of those countries I've just talked about, and give them the opportunity to start brainstorming and create a fun project that will address any of the issues that they want to focus on. Is it something to do with education or housing? And then I'm really, really particular on how I want my students to present there, because I really want them to do the work. And at the same time, that at the end of this project, they would really learn a lot. I would tell them to go out there to do a literature review about the topic they're interested in, and to give me some background information, because I want to make it real for them. I will even tell them that I'm going to give you 1.2 million to really put this project together. That's a lot of money, but when you're thinking about addressing some of these issues, 1.2 million is just nothing. So just to make it real for them. And then I'll tell them, what sort of background work are you going to do? Are you going to talk to the school board? Are you going to talk to the community leaders and all of this? Are you going to talk to your municipal building? And how do you promote this? Do you go to town halls? Do you go to schools and, to different neighborhoods? And then what sort of support team are you going to use? And who are you going to collaborate with? Are you going to collaborate with the health department or school or a church or whatever? And then they need to give me a budget. And then what's the benefit to this community in particular? And what's the global health impact? Are you trying to reduce the number of people who are poor in the neighborhood, or increase the number of homes and houses, affordable houses or something? And then they give me a conclusion. And then to be able to even make it fun for them, they're going to work on this as a project, and present a final paper. And I want them to present it to the class, because I want each of the students to know what the other people are doing. So they have to do a podcast for me, a 5 to 6 minutes podcast, and I have a 10 minutes question and answer. And this is what they cover, exactly what, whichever form they want the podcast to be. Oh, sorry. Another thing that's really interesting is I may tell them, I want you to do a communication plan. You have this good idea, but how are you going to reach your target population? Prepare something for me, just a one page, a Facebook or film or something like that. And this is a good communication plan. And this is one of the projects that they gave me a brochure for, I think it's for pregnant women. Okay. And, I need to evaluate it. I break it down so they know where most of the points are. So this is the last page. These are projects that my student put together. For the first one, it was a water filtration in Haiti because they have a lot of problem with water shortage and cholera and all that. They are creating a water filtration system and teaching people how to use filters and in very affordable, not so expensive, how to clean and have it in their homes. And the next one for Brazil is really creating a curriculum for kids in the, in the very poor neighborhood, the shanty neighborhood, where kids can even barely afford to have a laptop. So they're going to provide laptops, they're going to do some online courses, and then get them ready to go to college, because most of the kids in that neighborhood don't go to college. Mental health was what a group focused on, because a lot of stress that people in the poor neighborhoods go through, and they do not have access to mental health. And then having a mobile clinic is that. And then for the United States, is them having like a labor, like a Black labor equity, really advocating for Blacks who are in low income jobs in Louisiana, and really putting together a way that they can communicate with labor forces and make changes to some of the laws. This is about, the Canadian one is having a curriculum for medical students on health equity, on discrimination, on cultural competency, getting them ready as doctors. So when they go into practice, they really have a good grasp of what health equity and social determinant is. And this is something to do with stress as well, breaking the stigma, educating young teenagers, young adults, 16 to 15, about how to deal with stress and how to deal with mental health. And this is about, I think, something to do with water as well in Cuba. And this is about women who are pregnant, creating a polyclinic in their rural community, because that's another issue. There's this disparity between rural and urban, and barely clinics in the rural part of Haiti. So this is like a polyclinic, and usually it's an interesting concept that they use in Cuba that we thought would be good in Haiti. And this is something to do with clean water as well in Brazil. And this last one is for Nigeria, because of the lack of enough healthcare practitioners, and even the cancer awareness is very, very limited. We decided, because that's one of the projects I'm doing overseas, to create an e-learning tool, an e-learning training to train doctors and nurses and patients. So finally, let me go to the last page. My question now, I don't know how many more minutes I have, Anna Marie, but I would like us to, how could you use this information to create individual or group or joint collaborative projects for students? The little I've just shared with you, I know it's a rush and I haven't been able to go in depth with some of the issues, but just how do you think this can really align with some of your courses or some of the things you teach students?